1. A nurse is caring for a patient who had a stroke and now presents with expressive aphasia and right-sided weakness. What is the most appropriate initial action the nurse should take when communicating with this patient? Answer. Use simple yes or no questions and allow the patient time to respond. Rationale. Patients with expressive aphasia understand language, but have difficulty expressing themselves. Using simple questions and allowing time promotes effective communication and reduces frustration. 2. A nurse receives a report on 4 patients. Which patient should the nurse assess first? 1. A patient with multiple sclerosis who reports fatigue. 2. A patient with a concussion who is difficult to arouse. 3. A patient with Parkinson's disease requesting assistance to the bathroom. 4. A patient with chronic migraines requesting PRN medication. Answer. Assess the patient with a concussion who is difficult to arouse. Rationale. Decreased level of consciousness after a head injury may indicate increased intracranial pressure, a life-threatening condition requiring immediate assessment. 3. A patient is admitted with suspected meningitis. Which nursing intervention should take priority? Answer. Implement droplet precautions immediately. Rationale. Bacterial meningitis is highly contagious and can be transmitted through respiratory droplets. Prompt implementation of droplet precautions is critical to prevent transmission. 4. The nurse is caring for a patient who had a spinal cord injury at T6. What is the nurse's priority intervention upon noticing a sudden headache and flushing of the skin? Answer. Check the patient's bladder for distension. Rationale. Autonomic dysreflexia is a life-threatening condition often triggered by bladder distension in patients with high spinal cord injuries. Immediate bladder assessment is essential. 5. Which task is appropriate for the nurse to delegate to an unlicensed assistive personnel? UAP, caring for a patient post-stroke with left-sided weakness. Answer. Assist the patient with ambulation using a gait belt. Rationale. UAPs can assist with mobility under the supervision of a nurse, especially when safety measures like gait belts are used. 6. A nurse assesses a post-craniotomy patient and notes the head of the bed is flat. What is the immediate nursing action? Answer. Raise the head of the bed to 30 degrees. Rationale. Elevating the head of the bed reduces intracranial pressure and promotes venous drainage in post-craniotomy patients. 7. During a neurological assessment, a patient with a traumatic brain injury opens eyes to pain, has incomprehensible speech, and withdraws to pain. What is the patient's Glasgow Coma Scale score? Answer. The patient's GCS score is 8. Rationale. Eye opening to pain equals 2, incomprehensible speech equals 2. Withdrawal to pain equals 4. Total equals 8. A GCS score less than or equal to 8 indicates a need for possible intubation and intensive monitoring. 8. A nurse is preparing to administer phenytoin to a patient with a seizure disorder. What is the most critical assessment prior to administration? Answer. Check the patient's current serum phenytoin level. Rationale. Phenytoin has a narrow therapeutic range, 10 to 20 mcg/ml, and levels outside this range may cause toxicity or inadequate seizure control. 9. A patient with Guillain-Barré syndrome is experiencing progressive weakness and reports shortness of breath. What is the nurse's priority action? Answer. Assess respiratory rate and effort immediately. Rationale. Guillain-Barré syndrome can lead to respiratory muscle paralysis. Respiratory assessment is vital to detect early signs of respiratory failure. 10. A nurse enters a patient's room and finds them actively seizing. What is the nurse's first action? Answer. Turn the patient onto their side. Rationale. Placing the patient in a lateral position helps maintain the airway and prevent aspiration during seizure. 11. The nurse is evaluating the plan of care for a patient with increased intracranial pressure, ICP. Which intervention should be questioned? Answer: encouraging frequent coughing exercises. Rationale: coughing increases intrathoracic pressure, which may raise ICP. This intervention is inappropriate and should be avoided. 12. A patient with Alzheimer's disease frequently wanders. What is the best nursing intervention to promote safety? Answer: place a visual cue or sign on the patient's room door. Rationale: visual cues help orient patients with cognitive impairment and reduce confusion that may lead to wandering. 13. A nurse is caring for a patient with myasthenia gravis who is experiencing difficulty swallowing. What is the priority action? Answer: hold oral medications and notify the provider. Rationale: dysphagia increases the risk of aspiration. Holding medications prevents aspiration and allows time for reassessment by the provider. 14. Which patient should the nurse assess first after receiving shift report? 1. A patient with Bell's palsy requesting pain medication. 2. A patient with a concussion who reports nausea. 3. A patient with epilepsy with a history of seizures. 4. A patient with chronic back pain rating pain 7/10. Answer: assess the patient with a concussion who reports nausea. Rationale: nausea following head injury may indicate increased ICP. This is a neurological emergency that warrants immediate evaluation. 15. A nurse is caring for a patient with Parkinson's disease who has difficulty initiating movement. What is the best strategy to help the patient ambulate? Answer: encourage the patient to rock back and forth before stepping forward. Rationale: the rocking motion helps overcome the freezing episodes and facilitates initiation of movement in Parkinson's patients. 16. A nurse is reviewing the care needs for 4 patients. Which patient is appropriate to assign to a licensed practical nurse LPN? Answer: a patient with multiple sclerosis who needs scheduled oral medications and skin assessment. Rationale: LPNs can administer oral medications and perform basic assessments such as skin checks under RN supervision. 17. A nurse is assessing a patient with increased ICP. Which finding requires immediate intervention? Answer: a unilateral dilated pupil. Rationale: a unilateral dilated pupil may indicate brain herniation, a life-threatening complication of increased ICP that needs urgent attention. 18. A nurse is performing discharge teaching for a patient newly diagnosed with epilepsy. What is the most important point to emphasize? Answer: avoid driving until cleared by the healthcare provider. Rationale: seizures can impair consciousness and pose a danger when driving. Patients must be seizure-free for a certain period as per state laws. 19. A patient reports a sudden, severe headache described as the worst headache of my life. What is the priority nursing action? Answer: notify the provider immediately. Rationale: this may indicate a subarachnoid hemorrhage or ruptured aneurysm, requiring immediate medical evaluation and intervention. 20. A nurse is caring for a patient with a spinal cord injury at C4. What is the highest priority nursing diagnosis? Answer: ineffective breathing pattern related to neuromuscular impairment. Rationale: the C4 spinal level controls the diaphragm. Injury at or above this level can compromise respiratory function, making airway and breathing the top priority. 21. A patient with a history of seizures is found confused and disoriented postdictally. What is the most appropriate nursing action at this time? Answer: reorient the patient and ensure a calm, safe environment. Rationale: postdictal confusion is expected after seizure. Reorientation and safety measures prevent injury and reduce agitation. 22. A nurse receives report on a patient with a brain tumor experiencing increased ICP. Which assessment finding is most concerning? Answer: irregular respirations with widened pulse pressure. Rationale: these are signs of Cushing's triad. indicating critically elevated ICP and impending brain herniation. Immediate intervention is required. 23. A patient is scheduled for a cerebral angiography. What is the nurse's priority assessment before the procedure? Answer. Assess for allergy to iodine or shellfish. Rationale. Cerebral angiography uses contrast eye. Allergies to iodine or shellfish can cause severe reactions, making this a priority assessment. 24. The nurse is caring for a patient with suspected stroke. What is the highest priority during the initial assessment? Answer. Determine the time of symptom onset. Rationale. The time of symptom onset is critical in determining eligibility for thrombolytic therapy, e.g. TPA, which must be given within a specific window. 25. A patient with a recent head injury begins to exhibit restlessness and agitation. What is the nurse's best initial response? Answer. Assess the patient's level of consciousness and vital signs. Rationale. Restlessness may indicate increased ICP. A neurological and vital sign assessment helps identify changes that require immediate action. 26. A patient is being prepared for an electroencephalogram, E. What should the nurse include in pre-procedure teaching? Answer. Avoid caffeine for at least 8 hours before the procedure. Rationale. Caffeine stimulates brain activity and can alter EEG results, so it should be avoided pre-procedure. 27. The nurse is caring for a patient receiving intravenous mannitol for increased ICP. What is the most important assessment? Answer. Monitor serum osmolality and renal function. Rationale. Mannitol is an osmotic diuretic that can affect fluid balance and kidney function. Regular monitoring prevents complications such as dehydration or renal impairment. 28. A nurse is observing a new graduate nurse care for a patient post-lumbar puncture. Which action requires immediate intervention? Answer. Ambulating the patient 30 minutes after the procedure. Rationale. After a lumbar puncture, the patient should remain flat for several hours to prevent a post-lumbar puncture headache. 29. A patient with a spinal cord injury suddenly becomes diaphoretic and hypertensive. What is the nurse's priority action? Answer. Elevate the head of the bed and check for bladder distension. Rationale. This is likely autonomic dysreflexia, a medical emergency. Elevating the head and relieving the cause, often bladder distension, is crucial. 30. The nurse is educating a patient newly diagnosed with multiple sclerosis. Which statement by the patient indicates a need for further teaching? Answer. I will take hot showers to help relax my muscles. Rationale. Heat can worsen MS symptoms. This indicates the need for additional teaching on symptom management. 31. A patient presents with slurred speech, facial drooping, and right arm weakness. What is the nurse's priority action? Answer. Activate the stroke protocol and notify the stroke team. Rationale. These are classic stroke symptoms. Immediate action is essential to minimize brain damage and maximize recovery. 32. The nurse is caring for a patient with Huntington's disease. What is the most important focus of care planning? Answer. Ensuring safety due to risk of injury from involuntary movements. Rationale. Huntington's disease causes choreiform movements, increasing fall and injury risk. Safety is a top priority. 33. A nurse is providing discharge teaching to a patient recovering from a transient ischemic attack, TIA. What is the priority teaching point? Answer. Adherence to prescribed antiplatelet therapy. Rationale. TIAs are warning signs of stroke. Antiplatelets reduce the risk of thrombotic events, making them essential in prevention. 34. A patient with increased ICP is receiving care. Which positioning is most appropriate to reduce ICP? Answer. Head of bed elevated 30 degrees with neck in neutral alignment. Rationale. This position promotes venous drainage and prevents obstruction of venous outflow, reducing ICP effectively. 35. A patient reports new onset diplopia and difficulty walking. Which action should the nurse take first? Answer. Perform a focused neurological assessment. Rationale. These symptoms could signal a stroke or other acute neurological issue. Prompt assessment helps identify the need for urgent care. 36. A nurse caring for a patient with a ventriculostomy drain notices clear drainage leaking around the insertion site. What is the immediate nursing action? Answer. Notify the provider immediately. Rationale. Clear drainage may be cerebrospinal fluid (CSF) leak, increasing the risk of infection and requiring immediate medical evaluation. 37. A nurse is caring for a patient with advanced ALS who can no longer speak. What is the most effective way to assess their needs? Answer. Implement a communication board or eye-tracking device. Rationale. ALS affects voluntary muscles but not cognition. Alternative communication methods help maintain patient autonomy. 38. A patient has a new diagnosis of trigeminal neuralgia. What should the nurse include in the plan of care? Answer. Provide soft foods and avoid triggers like cold air. Rationale. Trigeminal neuralgia causes extreme facial pain. Avoiding triggers and soft foods reduce stimulation and discomfort. 39. The nurse is preparing to administer alteplase, TPA, to a stroke patient. What must be confirmed before administration? Answer. Confirm that non-contrast CT shows no evidence of hemorrhage. Rationale. Alteplase is contraindicated in hemorrhagic stroke. A non-contrast CT is essential to differentiate between ischemic and hemorrhagic stroke. 40. A nurse is caring for a patient with status epilepticus. Which prescribed medication should the nurse prepare to administer first? Answer. Intravenous lorazepam. Rationale. For lorazepam is the first-line treatment to stop continuous seizures quickly. Prompt administration prevents brain damage. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.